My name is Mrinal Sisodia. I'm the chair of the Bedford Borough Parent Carer Forum. I should say I've got the pleasure and the privilege of being the chair of the Bedford Borough Parent Carer Forum. And since last May, when I think I either had a moment of madness or stopped paying attention, I've been the chair of the Eastern region as well. Let's go back. The title is 1001 Nights. So we've got 50 minutes. You'll be delighted to hear that I'm not going to talk for 50 minutes, but I'm going to let most of my colleagues here do much of the talking. Secondly, we're not going to tell you 1001 stories. We're going to tell you 4 stories from the East. So the idea is that we maybe get you thinking a little bit, we perhaps entertain you a little bit, and maybe feed into some of the conversations we're going to have this afternoon. So, without further ado, I'm going to hand over to 2 guys from our local forums in the East. Firstly, we're going to start off with Steph, who's from Central Bedfordshire.
Hello, so yes, I'm Steph Rowley and I'm chair of the Parent Carer Forum in Central Bedfordshire. I think I draw the short straw here talking about culture change because I think we all know how hard that is. I want to start off by saying that in Central Bedfordshire we are very lucky that we have some key officers in key places that are very supportive of the reforms of the Parent Carer Forum and what can be achieved for our families. So that really helps us with the culture change, and it makes me feel really sad when I hear that some local authorities aren't even engaging with their Parent Carer Forum. I don't have the answer to that, but I can tell you some of the things that we're doing that we find help. So what we've done to try and work together with our local authority in Central Bedfordshire is that we've had clear expectations from the start of how we want to work with our local authority. One of the ways we reinforced that was to create a document, an agreement, if you like, between us and the local authority of how we wanted to work together. That spelled out some of the basics, having meetings at times when parents could attend, making sure everyone knows about the meeting with plenty of notice, sharing all the documents. But also we had this statement at the top that was basically saying, we're not just going to turn up and tick a box for you, that we've been there, we will be involved and we will make noise as necessary. And if we don't think it's going in the right direction, we will lead the work in the direction we feel it needs to go. And I think that's been really important for us in making sure that the local authority understood that we were there to make a difference and not just tick a box for them. One of the other things that our agreement stated was that we would provide trained reps to sit in those meetings with the local authorities. Trained sounds a bit formal. What we do is we get our parents in, we have cake, we have coffee, we have a chat, we tell them about all the things that they might be expected to do, the work that we've been doing with the local authority. But I think that's gone a long way to reassure the local authority that they weren't going to get emotional, shouty parents coming into the room, because I think they're, especially in the early days, and probably still now a little bit, I think they are a little bit wary of opening the door to us as parent carers. We can be a little bit scary at times. So I think that's gone a long way to help with that. Also, it's reassured our local authority that the reps that we send out are representative of the wider parent carer community locally, that it's not just that one rep's voice that they're going to be hearing. That has been influenced by as many parent carers as we can in Central Bedfordshire. So I think that's reassured as well, that it's good to have us in the room and that it will be productive. And so by having these clear expectations, it means that we can be equal partners. They did take us at our word and they gave us a work stream to lead in our Support and Aspiration Board, which is what oversees the reforms in Central Bedfordshire, and that really did focus the mind when I walked into a committee room in our local authority building and had to deliver a highlight report to all those other important people around the table. So we do feel like equal partners. We also have reps involved in all the work streams that are concerned with implementing the reforms, but also we follow our own agenda, so we have pieces of work concerned with what's important to our families locally in Central Beds. It doesn't always go well. We don't always manage to co-produce, and in those situations where co-production isn't working so well, we will gently remind the local authority. We'll share some documents and best practice, what co-production should look like. But I think one of the most powerful things we've had to do is say, actually, what you're doing is wasting everyone's time, and our reps aren't going to continue to work like this with you. And so what we did was we managed to get everyone in the room. I'm thinking of one particular example where there was a document that we were trying to create that just kept bouncing backwards and forwards. And so we said, you know what? Everyone just sit down in a room and do it together. And 3 hours later, we had a document that everyone was happy with and that really illustrated to them how to do co-production. But it's not just about changing the process. When you're trying to change culture, it's a lot more deeper than that. And so we try to remember when we're working with the local authority that these are families, and these are our families that we're making a difference for, hopefully, and we're improving things for. And one of the ways that we try to remember that is to ask, what does this mean? What is this actually going to mean to a family in Central Bedfordshire that are living with disabilities? And by keep asking ourselves that question, I think that helps us to remember that it's not just processes we're changing, that we're trying to have a positive impact on these families' lives. But doing all that work, it's all very well at a strategic level, but we need to share that message and let other people know what we're doing and what we're trying to achieve. We're leading by example at that strategic level where we're getting it right and co-producing with our local authority, but also where it's appropriate and we need to inform people locally about the reforms, about the impact that that's going to have. We will jointly present with our local authority. So, for example, we've done presentations for our GP locality groups where an officer from the local authority, and one of our reps will go along and we'll talk to those GPs about the impact that this is having, about what's happening and about how it's affecting families. Also, I think that works really well is when our officers present to our executive members of our local authority, where appropriate, again, for SEND stuff and stuff around the reforms, they will present that with the parent carer and even young people we've had involved in those presentations, and that really emphasises that co-production and that we're in this together and we're working together. And I found that really useful because then our executive members can hold our officers in the local authority to account what they're doing. Another thing that we do is we have an involvement and engagement officer in our forum, and that is her job. She goes out originally to get parent carers involved, but actually we found that that was an enormous task. So we started talking to the people that were supporting our families, so social workers, Senkos, all those kinds of people. The idea was that they would then be able to pass out our leaflets, but I think that's gone a long way to sharing the message in Central Bedfordshire and letting people know that this is about having a real impact on families and improving their lives. So Kirsty will go out and present to our professional study groups for the Senkos. She's done a lot of work there, and that's been really, really helpful in Central Bedfordshire for spreading the word. I think the most important thing is to spread the word and spread that down to the workforce that is helping and supporting our families on a daily basis. So in Central Bedfordshire we have a workforce development programme that has been developed and is delivered alongside parent carers. So again, we have been involved in the process of putting that together, taking a step back maybe from just looking at the processes they're changing. So it's not just about changing a statement to an EHC, for example. It's about talking about the impact that has on families, that we're not just looking at needs now as we were in a statement, but we're helping them to aspire to better things and a brighter future for those families. So I think that has been really important. The last thing that we've done is that we've created a short film with our local authority. Again, the idea behind that was quite simply just because we couldn't get people to all the meetings that we wanted to be at. but that has created a really powerful message, co-produced together, so it's very much the Parent Carer Forum and the local authority. And again, that focuses not just on the processes, on the implementation and the paperwork, but also the effect that this is having on our families and what our families want from the future. So yeah, that's what we've done in Central Bedfordshire. Hopefully it's given you a few ideas. I don't think it's all the answers by any means. But now I'll hand over to Lynn.
I'm the Parent Participation Manager for Bedford Borough Parent Care Forum. I'm a paid worker, but I'm also a parent carer. So that's a quick introduction to who I am. And this is a bit of a talk about a journey that we've gone on as a Parent Care Forum over the last year. You'll notice that Steph is a Bedfordshire Forum, and Bedford Borough is also a Bedfordshire Forum. We work in very small unitary authorities, and surprisingly, they work completely differently. I'm not quite sure how that works, but they do. So this is about how we have helped our authority to develop plans around the implementation of the Children and Families Act. Now, where we started was there's a lot in the Code of Practice about joint strategic needs assessments. I don't know if any of you know what that is and whether your local authority has got one, but what it essentially is an assessment of the needs of the local population. Prior to our instigation, there wasn't anything within the joint strategic needs assessment that mentioned SEND at all. I think there was maybe a sentence that mentioned vulnerable children, and that was about it. But I think from the Children and Families Act and the Code of Practice, it's very clear that actually the Joint Strategic Needs Assessment has a clear role in trying to define what the needs of the population are. And the question, it came about in a number of ways. We did a couple of things for the local authority, direct payments review, we looked at social care and a number of other things, and a lot of things were telling us that we need to know what the needs of the population are. We need to know how many children there are in Bedford Borough, and we need to know what their needs are. Marunal, as he does, goes and asks the elected members, those with the portfolio for social care, those with the portfolio for education, how many children in Bedford Borough have got SEN? And nobody could answer it. The best they could do was actually come up with how many statements we had in Bedford Borough, which, of course, we all know doesn't give the full story. So we set about writing a chapter for the Joint Strategic Needs Assessment that details the amount of what the population is, what their needs are, and how we can best meet them. Now, there wasn't a lot of data out there. A lot of the data is incomplete. It doesn't really overlap because you have health data that does 0 to 18, and then you have other data that stops at 16. So it was a bit of a jigsaw puzzle, and actually coming up with some kind of story out of that was quite difficult. But we did come up with a few things. We did come out with a number of interesting statistics, if you like. There's probably, I say probably because we don't have complete data, about 7,000 children and young people we send in Bedford Borough, which probably to those of you in big authorities sounds like a tiny amount. We have really poor inclusion in mainstream schools. And I think we knew that, but actually the statistics show that and show how poor we are compared to the national average. And also it's shown a glaring hole in what there is available for post-16, post-19 opportunities. We have very little in Bedford Borough. And I think probably, again, it would probably be reflected nationally, but early years SEND not being picked up as early as perhaps it should do. So there's some of the things that we picked up when we were writing the chapter for the JSNA. So from there, we've kind of developed our own aspirations. This is essentially what we would like to see happening in Bedford Borough by April 2018, when the government feels that all of this implementation should be done. That's kind of what we've worked on. So within this, we've outlined all of the main areas of the Children and Families Act, the obvious ones, the EHC, the local offer, joint commissioning, personal budgets, all of those things, and they all each have their page of this is what we want to achieve by 2018. And also within that, we've outlined what that means for people, what people need to do, what different processes we need, and where the money comes from. Now, this target state has been in development for some months, but I think now it is now signed off by everybody within Bedford Borough. It's been signed off by the mayor. We're a mayoral authority. It's been signed off by the elected members, and the latest sign-off was with the Health and Wellbeing Board. So we have quite a wide range of people involved and who know about it and who know what it says. So we've got this lovely aspiration. So how do we get there? And that's where all of these work streams, working groups, operational groups, whatever you want to call them, come in. We've tried to encourage so that they all know what they're doing. They've all got fairly similar terms of reference, so we're keeping it fairly simple, but also making sure that everybody knows what they should be achieving and what they should be doing. And the target state gives us a nice, easy way of actually referring back and saying, well, okay, so what are we working towards? What is this group supposed to do? Because I don't know about you, I've sat in many meetings where it just ends up being talking shop and nobody actually decides anything, achieves anything, and you come out thinking, well, what was the point of that? So it's kind of trying to give the direction and make sure that we have ways of holding them to account and saying, well, actually, you've ignored this bit. It says in the target state that everybody's agreed. This is what we're aiming towards. And if we're not aiming towards it, you need to change your target state and give us good reasons why. So it's actually, I think for me, it's been a way of actually holding them to account in a certain extent, but also giving that direction and that guidance as to how we get to where we want to be. And within the target state, we've got a project management, and actually the Bedford Borough is co-producing, no, it's really the quite word, co-leading on the project management of all of this. So alongside our SEND colleagues at the local authority, the Parent Carer Forum is actually part of the project management team. And we recently sourced a project manager who is a parent carer. So she's very aware of parent carer views, but is working for the local authority. And within this target state, we've got that clear governance and accountability structure. So we know where we can go if things get stuck. We have regular meetings with the people within the SEND team who are primarily tasked with implementing the Children and Families Act, but we also have meetings with the mayor and elected members, because actually sometimes when there are issues that are bureaucratic, which they inevitably are in local authority, we can talk to the mayor about it and say, well, actually, this is putting barriers in the way, and can you do something about it? The other thing that we've made sure is that one thing that I've found with working with local authorities is there's very little looking back and asking how did we do? And we've sort of built this into the project plan. Some of it is numbers, statistics, so how many EHC plans are converted and by when, which don't really tell the whole story, but they are part of the bigger picture. So we're looking at what numbers we can collect, but also how do we collect the quality. How do we know that things that are being produced are quality, so the qualitative information. And that's where the Parent Carer Forum comes in, because that's all about parent carer views, young people views, and making sure that people are involved. We still need to do more. We're still not 100% in terms of getting that qualitative data. I don't think we're entirely there yet, but we're still working on it. But basically what we've got currently is we're now in a local authority that they wrote their transition plan for the conversion of statements to EHC plans back in last summer. They're on time with that. They're actually converting the amount of plans that they said they were going to do. Quite how good they are is another matter, and that's what we're now going on to look at. We're now working on the quality side of EHC plans. The local offer, it does reflect what parents told us and we told them that it wanted to do. But, again, it's still not meeting the aspirational side of the things that parents wanted it to do. So, again, there's still work to do. And workforce development as well, and I think this is one of the biggest things that we need to address in Bedford Borough, is there's a lot of things that can happen within the workforce that works amongst children and young people with SEND. And actually, I think, from my point of view, this is where the biggest impact can be made. You've got to change those attitudes, you've got to change those ways of working, and this is somewhere where the Parent Care Forum is actually leading the workforce development role. We're doing it in conjunction with the local authority and the health and the CCG and everybody else, but actually we are leading within this. And again, we're only just, particularly here, only on the start of the journey, and there's a long way to go. But actually, having that project plan, having that target state, gives us some way of knowing where we're going and making sure that we're actually getting there, and gives us a way of checking to make sure that we're getting there.